What are your thoughts on C-section surgery? Does this save lives?
Yeah, so cesarean section, very common procedure, and it's a bit like prostate surgery and the other things I've mentioned. Is there a case where cesarean section may save the life or save the baby? For sure, there's no doubt there's going to be cases where the baby's not coming out. There's an obstruction there or something, and there's something terrible is going to happen if you don't do a cesarean section. These cases exist. However, how do we explain the fact that cesarean rates vary widely between countries and between regions and between individual doctors and between hospitals? The World Health Organization has tried to limit this because we know that cesarean sections are overdone, and they originally said that the ideal rate should be somewhere around 10% of births. They changed that to, I think, 15% or something, and nobody really knows what the exact number is. But these are the numbers that have been bandied around. And yet you have some regions like in China and Brazil where the cesarean section rate is 50% of births. So half of all births are delivered by cesarean section. Well, that's crazy, and there's no way that amount is necessary. In the US and Australia, it's around a third, somewhere between 30-33%, or up to 35%, and that's considered too high as well. I mean, here you have a natural process. I mean, people have been giving birth for a long time. Do we really think that a third of all births need a cesarean section? I mean, that's a huge number. And are we considering the downside bad effects of having a cesarean section, the scarring that occurs, the need for further cesarean sections in later births, the other issues that occur with bonding, the risks of surgery themselves? Is it always necessary? And when you look into it, a lot of the reasons that obstetricians use to do a cesarean section are not well justified. And so you get this backlash against that, and you get birthing centres set up where it's midwife only. It's not run by an obstetrician. Now, sure, patients are sometimes selected where a really high risk patient who's perhaps got diabetes associated with pregnancy or blood pressure problems. Maybe that patient needs to be in a higher care unit. But in studies where they've compared large numbers of people that have gone through birthing centres and those who have gone through hospitals supervised by an obstetrician, have not shown a difference in the infant mortality rate. In fact, they have shown a difference in the intervention rate. So the C-section rate is higher where you're being treated in a hospital, but it doesn't equate to saved lives. So are there cases where a cesarean section can save a life? Yes. Is that the case for every cesarean section that's done? And does it justify rates of 1/3 or 1/2? No.
What are your thoughts about joint replacement surgery?
Yeah, I think I've kind of covered that. The two most common ones are hip and knee. I mean, there's lots of shoulder replacements, and you can even do ankle replacements and wrist replacements, but these are very small numbers. When you're talking about knee replacement alone, that's the most common one. You're talking about nearly 1 million a year in the US, several million procedures worldwide. So this is a massive common operation. I think it's overdone. I think a lot of patients could be treated non-operatively. A good example of this is that the average patient who has a knee replacement is overweight, is obese. Not just overweight, but obese. And we know that obesity is associated with knee pain and osteoarthritis. There's reasonable evidence that getting patients to lose weight can decrease their knee pain, and for maybe 10% of patients, 15% of patients, they can avoid having a knee replacement altogether. So that's a whole lot of knee replacements that we could avoid if we got people to lose weight. And if we got them to lose weight, it would also affect their other health, their general health. They'll be less likely to have diabetes and all the associations that go with diabetes. So you would be creating this huge increase in health by getting people to lose weight. But often we don't look into that. Someone comes in with arthritic knee, they're overweight. Okay, we'll replace the knee. And we don't say to them, well, look, if you lost, this much weight, 5%, 10% of your body weight, you might not need a knee replacement, and your diabetes might go away, and your risk of heart disease will plummet, and you'll live a lot longer. We often don't have that conversation, unfortunately.
What are your thoughts on broken bone surgery?
It can be hugely helpful. Let me pick an example that I haven't already mentioned. The thigh bone, or the femur, which is the bone between your hip and your knee, is the biggest bone in the body, and it's often broken in car accidents, motorbike accidents, falls, and things like that. And I treat a lot of those injuries, and still do. Just before I started my practice, and still with a couple of the old school surgeons when I started my practice, but certainly back in the 60s and before that, these were often treated in traction. So these are young men who came off their motorbike. They would be put in traction in hospital for months. All right, so not working, muscles wasting away, tying up a bed, huge cost. To them and society, their family. They can't look after their family. They're not earning money. They're stuck in hospital for months. The fractures would heal by and large. It's not like they wouldn't heal, but often treating them in traction, they wouldn't heal quite that straight. They'd often be a little bit short, so the patient would be limping afterwards. So there's some functional impairment. But they would get back to society. They'd go home again. I mean, for ages, femur fractures were treated in traction. It's not a complete disaster. But these days we have operations where we can treat that fairly safely. We can do a fairly low risk operation the day they come in, or the day after they come in. They can be home in a few days walking on it. They can actually be taking weight on it with a metal rod. It'll heal dead straight. It'll heal at the same length as the other leg, so they won't have a limp afterwards. And so here's an operation that works really well. Is it completely necessary? Well, no. You can treat a femur fracture without surgery. It's just that it saves a whole lot of time and a whole lot of money and a whole lot of hassle, and that alone is worth the surgery. So yeah, it can be very effective. On the other end of the spectrum, there's fractures that are often treated surgically that probably don't benefit. So wrist fractures are about the most common fracture in older people. You just slip over and fall on their wrist and break their wrist. We just published about 2 weeks ago in JAMA Surgery a study we did comparing surgery for that, where we put plates and screws in to fix it, compared to just old-fashioned plaster. Showed no difference in the results at 12 months. So patients who are treated surgically, yeah, it sounds like a good idea. It's really common, and a lot of hospitals around here and in the US treat all of these cases surgically, or nearly all of them surgically, but there's no average benefit to the patient. You can put them in plaster and they'll do just as well.